Hello and welcome to the How to Carnivore podcast. I'm your host, Simon Lewis, and you're tuning into the Plant-Free MD series with Dr. Anthony Chaffee. Dr. Chaffee is a surgeon, nutritional researcher, and former pro rugby player.
The root cause of a lot of these joint pains.
Yeah, so commonly we get pain in our joints because of arthritis and damage to the cartilage, which then wears down to the bone. The bone has a lot of nerve endings, and they can be quite painful. So once these start rubbing together, you're getting a lot of pain. The cartilage doesn't have any nerves to speak of, so you don't feel anything there. So it's when they wear through that you start to have a problem. But at the same time, your experience of pain is going to be worsened or lessened depending on what you eat and what you have in your body. If you have a lot of inflammation and things that you're eating or things that you're doing are building up different inflammatory factors in your body, they will sort of latch onto these areas of damage and they will exacerbate that pain. So if you have arthritis in your knees, which I have on my patellas, because of just years of kickboxing since I was a kid, doing knee strikes, that just damages the cartilage. I didn't know that at the time, but that's what happened. The rest of the knee is perfect. All of my other joints are perfect, but there's just that one area and it's worn away, and that causes a problem. When I was eating sort of a normal diet, that was fairly painful. Now it's not really painful at all, and it's actually worse because it's broken down more since then. You'll see different arthritis patients and arthritis sufferers who end up getting joint replacements or needing joint replacements. And then all of a sudden they switch their diet, they go on a carnivore diet or even a ketogenic diet, and they remove so much of this inflammation, and they are eating more healthful foods such as fatty meats, that they reduce their inflammation, they reduce their pain, and all of a sudden they don't need any surgeries anymore. Dr. Sean Baker, he found this out in his practice. He was keto at the time, and he was encouraging people to get on this diet, and they were all of a sudden didn't need joint replacements, didn't need shoulder replacements. Maybe they replaced one and they were planning to do the other, and then all of a sudden they said, actually I don't need that. In true selfish fashion, the hospital group that he worked with got really upset at him because surgeries pay the bills. And so, he's bringing in office visits and he's actually curing people, like a doctor, and he's helping people avoid surgery, which really is what you're supposed to do. But that's not what brought in the money. So they actually had a big problem with him. In my own practice, neurosurgery, people having very bad back pain, which you really can't do much for except under particular circumstances for back pain. There's not really many spinal surgeries that help pain. Most of the time it's musculoskeletal. You get just weakening of the muscles, and you can't support these joints properly. You just get backaches and you get bad posture that exacerbates it. You get arthritis in the joints. And there's not really much you can do for that. We don't have good treatments for that yet from a surgical perspective. So, people come horrible back pain, and we don't really have any surgical options for them, or they have bad back pain and they have bad shooting nerve pain called radiculopathy down one or both of their legs from pinched nerves. Well, doing surgery on that area can fix the pinched nerve, but it's going to make the back pain worse, because now we're destabilizing that. We're cutting through tissue. We're separating the muscles from the bone. We're removing bone, and you already had a sore back because it wasn't strong enough to support it and had a lot of inflammation, and now it's even worse because now it's damaged tissue. So you fix that one problem and you worsen another problem sometimes. But when you reduce the inflammation in these patients, quite often they don't even need surgery in the first place, and my back pain is worlds better. I had horrible back pain since I was about 15. Now I don't really have much to speak of. It's just a bit of an annoyance every now and then. But as long as I'm not eating anything stupid or nothing slips in when I'm eating, I mostly don't notice it. So there are a lot of different things that can cause that. But to give a specific example, or a particular example, how do we combat this? We take anti-inflammatories, right? So non-steroidal anti-inflammatories or steroidal anti-inflammatories like prednisone, prednisolone. Those work. And if you have, you get a cortisone injection in your shoulder, like you don't have pain anymore. It just calms all that down because it just stops the inflammation. The non-steroidal anti-inflammatories, these work on different factors that cause inflammation and cause an exacerbation of this sensation of pain. Well, a lot of those molecules that anti-inflammatories such as selective COX inhibitors such as Celebrex or even aspirin and ibuprofen, they work on the downstream finished products of omega-6 fatty acids and omega-6. Yeah, so omega-6s and omega-3s are nearly identical molecules. They just have just a subtle difference in the shape, and they go down different biochemical pathways and then become different molecules at the end. And you need these things. You need both of them, but you don't need as much omega-6s as we're getting in our diet. And the final product of that is what these anti-inflammatories work on. So it's just something to think about. You're taking anti-inflammatories to stuff these guys down, and when you're eating things with omega-6s, you're bolstering up that number. Yeah, and so when you have a healing area, you have this nidus of healing tissue or angry tissue. This is where these things seem to glom on for whatever reason. Well, you have an inflammatory process. I mean, your immune system is the inflammatory process is your immune system acting. And so when you have a healing process, your immune system is going in there to try to heal this. So it's causing inflammation. There's healthy inflammation. There's very healthy inflammation. We don't heal without inflammation. And so, but you can have pathological inflammation. When you have too much and it's causing a problem, it can cause pain. And so these things come in, all these factors come in, and there's just an abundance of them and the wrong types, and you feel a lot more pain. You experience more pain and more swelling and more stiffness. And so when we work out and we exercise, we get little muscle tears and breakdown of our muscle fibers, and then that's healing. And so we bring in these inflammatory factors to heal these muscles. And because we're bringing in too much or too much of the wrong kind of inflammatory factor, it hurts. And so when you don't eat that stuff, you don't have that in your body in the first place. And so people are finding